And thank you so much, everyone, for joining us this Friday for this COVID-19 press briefing. Today, Orange County Mayor Jerry L. Demings will discuss the recently released CDC guidance and what that means for us here in Orange County. Now, incredible work has been done over at the Orange County Convention Center as it relates to combating the virus, and not just by the employees of Orange County government. The mayor will recognize some individuals, both who have worked for the county and outside of the county, who have worked so very hard to keep our residents healthy and safe. The mayor will also discuss our testing locations, positivity rates, vaccination locations, and how to get there, and other details as well. Orlando Mayor Buddy Dyer could not be here with us today. However, Dr. Raul Pino from the Florida Department of Health in Orange County is here with the state updates, positivity rates, and other important information. We'll begin with Mayor Demings. Mayor?
All right. Hello, everyone. Hopefully you're having a great Friday. We're having a great Friday here in Orange County. A lot has happened this week in Orange County, and I want to start by just sharing with you the immediate good news is that we reached the 50% mark of having those 16 and older vaccinated within our community. And if you recall, that meant that when we reached that pinnacle, we would not require the wearing of facial coverings when outdoors. So it's really pretty exciting to note that the new CDC guidelines nearly mirror the projections that we had put in place here within Orange County. Missed it by perhaps just a few hours of getting to the point where we knew that likely this week we would reach that pinnacle of 50% where we would relax the requirements for wearing facial coverings here within our community. And we had said to you that it was our goal that when Orange County's vaccinated population reached 70% for the eligible group, that no one would be required to wear facial coverings. Well, guess what? The CDC and the president's goal is that by July 4th of this year, no Americans should be required to wear facial coverings if we get to that 70% mark. Same goal. We believe that Dr. Pino will verify this in just a few moments, that perhaps by July the 4th, if not before, we can reach that same level within our community. So there's no inconsistency, is what I'm saying to you, in terms of what the CDC guidelines are at this point and those phased approaches that we were taking here within our community. In essence, we were spot on with the recommendations that we were putting in place. So that is just extraordinarily encouraging. So we're making some modifications here even within Orange County. I know the CDC released some new guidelines yesterday, as we have talked about, and it made the news and to some extent created a lot of excitement, I think, for all Americans that we are soon to return to some sense of normalcy. I'm going to share some additional details with you going forward. I will remind all of our residents that we still need to be prudent in our efforts to stop the spread of COVID-19 in our community. We had nearly 300 new cases reported yesterday and 3 additional deaths. So that does mean that the virus is still in our community. And if you have not been vaccinated, then you should consider wearing a facial covering. You should consider protecting yourself, your family members. If you have children, you should consider protecting them by wearing facial coverings. You can assume that if you follow the CDC guidelines for those who are fully vaccinated, the guidelines really impact that group the most. If you're fully vaccinated, they're saying that you should not be required to wear facial coverings. But if you are not vaccinated, they're recommending that you do wear facial coverings to protect yourself because, again, the virus is still spreading amongst us. So now let me just share with you, where is Orange County government? Orange County facilities are open to the public, will generally follow CDC guidelines regarding the wearing of facial coverings. However, we will continue to maintain social distancing of 3 feet for the foreseeable future. Now, when we shared with our staff that we were making an internal policy as well as a public policy about the wearing of facial coverings, our staff was extraordinarily excited. Some of them did backflips because of that. But here we are. So since March of last year, the Orange County Convention Center has served as a state-run regional COVID-19 testing site. As a reminder, it will close on Sunday as a regional testing site. The site and its workers provided a vital public service to the residents of Central Florida, offering both antigen or rapid tests and PCR tests for months now. In all, more than 450,000 tests were administered since March of 2020 at the Convention Center site. At any point, over 200 individuals were involved in keeping the site running smoothly. I would like to recognize 7 of the men and women who led this Herculean effort. When I call your names, I'm going to ask that you please stand and be recognized. First, I'm going to begin with the Florida Department of Emergency Management Region 5 Representative, Ms. Claudia Baker. All right. Then we're going to recognize Incident Commander Mark Reale, who opened the site and worked closely with our Emergency Operations Center and our Emergency Manager, Chief Lorelei Avery. Chief Avery? She's standing over to my right. Planning and Logistics Section Chief Randy Brown, who managed the 200+ staff members and submitted the situational reports to the state and county. Sergeant Terrell Vaughn of the Florida National Guard. Sergeant Vaughn managed a team of soldiers at the patient check-in registration for COVID testing. Sergeant Vaughn. Specialist Rando Quintino, Senior Medic of the Florida National Guard. Specialist Quintino coordinated testing and vaccination efforts with a team of soldiers assigned to the testing site. Specialist Noel Montanez was the situation unit leader for the Florida National Guard. Specialist Montanez collected and reported all testing information daily. And Specialist Clive Joseph, the supply unit leader for the Florida National Guard. Specialist Joseph handled the processing of over 1 million PPE at the Convention Center. Specialist Joseph. On behalf of the nearly 1.4 million people who call Orange County home, and I want to say to all of you, thank you for what you have done, yeoman's work during the last year. And I also must acknowledge the Florida Department of Emergency Management for the collaboration during this period of time, and the Florida Department of Health. They have all been wonderful partners. Please join me now in applauding the efforts of the entire group who worked here within Orange County. Muchas gracias. Merci beaucoup. While the testing ends on Sunday at the Convention Center, our Barnett Park remains a convenient drive-through testing site. The site is open 7 days a week from 9 a.m. to 5 p.m. You do not need an appointment to get a free test. Barnett Park also offers a drive-through COVID vaccination site. No appointments are necessary for getting a vaccination as well. With children 12 years and up, who are now eligible for the Pfizer vaccine, we have seen an uptick now in the vaccinations. That's good news. Our Orange County Department of Health has been operating at 4 of our recreation centers for the past week or so, providing vaccinations, and a total of 132 vaccinations have been given between the 4 sites. But we have noted that nearly 47% of the vaccinations yesterday at our recreation center sites were made up of those in the age bracket of 12 to 15. So we are seeing new, I think, interest in getting the 12 to 15-year-olds vaccinated by our parents here in the community. We do ask that you please remember to have that we have our 4 recreation centers, our magic gyms throughout the county operating as vaccination sites. They will be open Tuesday through Sundays, and the drive-through site will be located again at Barnett Park 7 days per week. So please take advantage of weekend vaccination opportunities. Summer activities are waiting for you and your family to enjoy. You can make online appointments for vaccinations at the Barber Park location, which will begin next week. You can go to our website at ocfl.net/vaccine for details. It is also encouraging to hear that Orange County Public Schools will continue to provide vaccinations at schools this Saturday. Between hours of 8 a.m. to noon, they will offer COVID-19 vaccinations to anyone at East River High School and Wekiva High School. You can get information from the school district's website at ocps.net. Dr. Pino will mention in just a few moments what we're seeing in terms of the rate of infections amongst our young people. Since February the 11th, the Orange County has partnered with Links to offer free rides to vulnerable seniors who are 60 and older and could not get a ride to the Orange County Convention Center or the FEMA site at Valencia College's West Campus. So far, Access Links has made 750 trips to these vaccination sites, which resulted in over 450 seniors able to get vaccinated. Again, the sites are shutting down. The Convention Center is closing next Friday, May the 21st, and the FEMA site will close on May the 25th. The Access Links opportunity will not end. We are going to continue that process. So here's a news flash. Starting on Monday, Access Links will offer round-trip rides to vulnerable seniors 60 and over to all of our 4 recreation center vaccination sites. To qualify for a ride, you can call 311 to register through our Office of Emergency Management. We ask that vulnerable seniors schedule their pickup at least 48 hours in advance. I want to thank Links for their partnership and their contribution to this effort. We'll talk now about the numbers. Since the start of the pandemic, there have been a reported 140,000 plus COVID-19 cases in Orange County. 1,282 of our residents have died of the novel coronavirus. The 14-day positivity rate is now 5.7%. It continues to decline and shows how Orange County residents are working together to create a safe community for all of us. And let me talk a little bit now about our hospitality workers. For the last 2 weeks, Hilton Orlando has been offering COVID-19 vaccinations to all Orlando-based hospitality team members and their families on site in its parking garage. Over 1,000 people have been vaccinated at this site so far, and due to the success of this program, Hilton Orlando and the Florida Division of Emergency Management have decided to extend this opportunity through the end of June. The site will be open every day from 8 a.m. to 6 p.m. for everyone 12 and up. It's not just limited to hospitality industry workers. This walk-up site has Johnson & Johnson and Pfizer vaccines. Hilton Orlando is located at 6001 Destination Parkway in Orlando. No appointments are needed. In addition, on Wednesday, May the 12th, the Rosen Inn International hosted a drive-through COVID-19 vaccination event for all Rosen employees. Orange County Health Services provided Rosen's medical clinic with vaccines to administer. 53 staff members were vaccinated. We love to highlight the employers who put the safety and welfare of their teams first and are offering vaccinations at convenient times in order to allow employees to go to work. Thank you to the Hilton Orlando, the Rosen Hotels, and other businesses that are working to ensure our hospitality industry can continue to flourish and serve all of our visitors. And now, Dr. Raul Pino will share with you additional information.
Good afternoon. Thank you, Mayor. Good afternoon, everyone. Good to be here. Before I go into the data, I want to mention that there are two staff from the health department here. One is Emily Pico, who will be able to talk to the press, if you want to, about our work with employers and people who have invited us, farm workers, and other of the tourist industry, and how that work is going. And she's also responsible, together with Deb, for the trailer and what is going around on our site. And Deb, could you stand up, please? So, Deborah Collins is our emergency management manager at the Department of Health. And we have been praised, the county and the health department, for the work at the Orange Convention Center and how well that oil machine expression that people have used. So I want people to know who is behind the curtain and who has done all the work and who is responsible in large for the success of our operations at the convention center. So thank you from here. Thank you. That for the numbers, as the mayor mentioned, we have a cumulative 140,132 cases. Our recovery rate continued to be at 97%, and our 14-day rolling average is at 5.7. The last time that we talked to you was at 6.1. The total number of deaths is 1,282. 9 additional deaths were added. 3 female, 6 male, 3 black, 4 white, 2 other, 3 were Hispanics, 6 were non-Hispanic. 4 have underlying conditions, 5 we don't know yet. Now, one of those is from August, the other one is from September, 1 is from April, and 6 are from May. We have talked before about what the process get delayed, what some cases get reviewed, and what they take sometimes a little bit longer, although that has improved tremendously. The variant cases that you are all very interested are total right now. It is 673. The age range of from January to yesterday are from 0 to 97 years old, and the median age is 33. There are no new deaths that we know on cases of the variant. The total continues to be at 5. There is 1 new hospitalization on those cases, and 6 total that we know. One of the new cases is travel-related, and is from a person who traveled to Maryland. For the vaccines and the breakthrough cases, our total is at 254. There are 71 that are Johnson & Johnson, 36 are Moderna, 145 are Pfizer, and 2 we don't know. And those numbers kind of correspond with the level that we have used those vaccines. As the mayor mentioned, the CDC has released new guidelines, but it doesn't mean that we individually could not take responsibility, because that's what is happening now. We are shifting from a community responsibility to a personal responsibility as we get to these high levels of immunization above 50%. So it is important for those who are not vaccinated that you protect yourself. The virus is still around. You should protect yourself. You should wear a mask if you are unvaccinated. You should wash your distance. You should wash your hands. That doesn't prevent it from happening. With regard to immunizations, the total number of doses administered to people over 16 is 978,436. The total number of people, now these are individuals, this number is individual, that have received at least one dose, 584,265. And that is 50% of our population. And residents with series completed is 456,551. Also, like yesterday I have to grab the point. Also, yesterday we saw an increase in the vaccinations at the site. We were expecting it. So the total yesterday was 812 vaccinations on those gyms and Barner Park. And about 47% of those vaccines that we did yesterday were on young people that are 12 to 15. We are expecting those numbers to continue to increase as people get familiar with the process, they get familiar with the consent form, and that the consent form will be available for everyone to download, print, and use. We are also going to open the convention center Monday through Friday for COVID-19 first dose vaccine. As you know, the convention center has only been offering second doses for the last couple of weeks. So in consideration to the increased demand for 12 to 15 years old, and now all the students go to our public schools, so the site is intended to increase vaccination rates among 12 to 15, but we will open for first dose for anyone that registered through the website. It's a caveat with that, is that at your second dose, it will not happen at the convention center. You will have to go to any of the gyms or any future sites that may be open. So keep your card, but remember, all vaccines are in a single record for the state in Florida shots, so any site that you go will have access to your information and will be able to enter that information. Also today and tomorrow, we are offering Moderna at the convention center, large volume of Moderna. That's why we didn't open today and tomorrow for 12 to 15, because it would be extremely confusing to have these things running at the same time, the Pfizer, the Moderna, and then the 12 to 15-year-old. I want to show you some data. Okay, this is our dashboard that we use. So in the upper corner over here, you have our epic curve daily. So the decline in a number of cases is just constant and precipitous. We are in remission totally in our county here. Next page. Could you do the first one, because Lauren is going to ask. Could you go back to the first before she asks me? So these are the index that we have calculated for risk. So that index that we calculated is a social vulnerability index from the CDC that we added a couple of things. We also added number of cases, number of deaths, and the transmission in each of those sites. These are census tracts, so we know the darker, the more priority we should give to that place. And this is what we use to determine, okay, we need to go there, we need to vaccinate there. Where is this site located? Is it located in this place or that place? Next. These are the variants. We are tracking the variants day by day. They are color-coded by the type. Next. These are related deaths by day. And as you can see, I mean, the decline is completely. Next. This correlates, this is the median age. We continues to be around 30, it's now 32. And also it take in consideration the number of cases by age group and the correlation with the number of deaths in that same age group. You have seen this graph before. Next. This is positivity rate. And this is where we are today. And you can see from the 8 and 7.5, and before this we were 8. I continue to decline every day, slowly but surely. And these are the number of cases per week, which is also continue to decline. And this is the positivity rate by age. And I want to call people attention to this group over here. If we want to continue to make an impact in our pandemic, we really have to vaccinate people between 15 to 24 years old. It is critical for the colleges in our area. It is critical for those places involved with young adults between 15 and 24, gyms, other places, to try to increase vaccination rates, because this is where the bulk of the new cases are at. Next. This is long-term care facilities. And interesting enough, these are patients, these are employees. It is our recommendation for long-term care facilities, vaccinate your employees, vaccinate new employees that come into place. Most of the cases that we have seen lately in long-term care facilities, we can track it to a positive employee that transmitted to a senior. These are very vulnerable segment of the population. We should protect them even more. So employers of long-term care facilities, please encourage, and if you can, demand that your employees get vaccinated. Next. This is the incident rate in students 5 to 17 years old. And you see this is what we have used with the schools. And you can see also a decline, a total decline in the number of cases in that age group. Next. And this is our hospital data. Now, this data includes elective procedures. So this is COVID plus elective procedures. So if you can see, we achieve a peak of hospitalizations over here. And, I was a little bit concerned. I think I mentioned to the mayor, we saw this blip here, a little bit of increase of hospitalization, but it continues to decline right after. This is where we are today. And I want to call to the health of our health system. We have almost 5,000 beds in our county. 22% of those beds are available, even with elective procedures, and the number of people in ICU has reduced by 50%. Next. Oh, that's so the map and then the trailer, please. So this is a map that the Board of Education did and kindly provide us with. So we get prepared to get involved more with the school-age population. We also look at the fact that most of our population, it is, in red you have 5, and in gray you have 10 miles. Most of our population resides within 5 miles of any of the sites that we are operating the gyms. Now, thanks to this work from the school, we also identified that we may have to do some work in this area over here. We may have to do some mobile work in this area because it's not highly populated, so it doesn't justify to have a permanent location. And we also may have to work into establishing a location in the Apaca and Ocoee area. And then this is a new feature that is going to be added because our trailer is mobile around the county. So anytime that you go into the county page, you can click on the trailer. The one in color will be the active, and the one in grays will be where it was before. And it's going to tell you where it's located, how many hours are going to operate, and people could go to the trailer immediately if they want. This is a walkthrough event, and it's located in different parts of the county every day, or sometimes even twice a day. But for sure, it's always on Wednesday. What time on Wednesday? 9 to 11. It will be always on Wednesday at Eola Park. And we have actually been very successful vaccinating individuals at Eola Park. With that, any questions that you may have, Mayor?
All right, we do have Scott Howard here from the school district. If there are any questions relative to the schools. We have Commissioner Gomez Cordero, who joined us. Commissioner Myra Uribe has joined us as well. Division Chief Avery, our Emergency Operations Center and Director and Emergency Manager. Ms. Ilia Torres can do the translation if there are questions in Spanish. And then other staff that's here that can do the backup. So with that, we'll open it up for any questions.
Lauren Seabrook, Channel 9. My question's for Dr. Pino.
And it's not about the map.
It's not about the map. I'm curious with the CDC's new guidelines. It seems that a lot of people feel like this means the pandemic is over. And you've showed us a lot of information here about how good things look for us, but we do still have deaths and cases every day. So I'm curious, does that concern you that people feel that way? And are we at a point where we've had enough people vaccinated that we're really kind of, out of the bad times? Or how are you feeling about that?
So those are interesting questions. I think there are two orange counties, the one that we live and the one that people visit. And those, for public health, have different connotations. The one that we live in, we know who's vaccinated. We know that we have achieved 50%. And the one that people visit, the parks, which is a congregating setting that is going to increase capacity, may receive people from all over the world. It does every day. And we have 75 million visitors before the pandemic. So it's not just a small number. So with that, precautions are going to be necessary. But it has to be some type of benefit to be vaccinated. And the reality is that it decreased death, it decreased hospitalization, it decreased infections. So the concern that people have, some people may not be vaccinated and they are not wearing a mask, that is on that individual. That is on that individual that is not protecting themselves and not protecting their family. There are still asymptomatic cases. You can still bring it back home. You can still pass the infection to someone that is immune suppressed or someone that is with the pre-existing conditions. So it's now on the individual if they want to take that responsibility and protect themselves and protect the family. I think the government has been to a point that we have achieved a level of immunization that justify relaxing those measures for those who are fully vaccinated.
Nikki Zizaza with News 6. This question is for Dr. Pino. Dr. Pino, we've recently heard of some breakthrough cases, for instance, with some of the Yankee players who have been fully vaccinated. Is that a concern for you in terms of what we could see here in Orlando? Have you heard of anything like that where people who are fully vaccinated are still getting COVID and it's kind of raising these concerns nationwide?
Yeah, but the reality is that this always has been an expectation that it could happen. The vaccines are not 100% effective. The vaccines are in the 90s. So it's always a percentage of people that could get infection after being vaccinated. And the reasons could be many reasons. It could be from how your immune system reacts to the vaccine. Was it rightly timed? You got the right dose? Those other factors are so many. But the reality is, in the case of the players, that they are in a congregated environment, a very close environment where they are playing, when they are training, when they are around their co-workers or players, exercising and doing those activities. So some level of precaution is always needed when you are in a congregating environment. But the fact that they got it, for most, is going to be very mild. Most of them are asymptomatic, and that's what you expect after being vaccinated, because part of the protection is not to develop the disease, the full disease.
This is Melissa Thomas with Florida National News. This question is for you, Dr. Pino. Now with the increase in interest with the younger age group getting the vaccine, did you notice any changes in procedures that would need to happen at the Orange County Convention Center site as it relates to serving that younger audience versus having served the older audience?
So the consent form has changed. That includes for 12 to 15 in the convention center students or kids from 15 and up, and also 12 to 15 should come with an adult. They should not go there themselves. Now, the state has released some provisions, but we will have to talk to the school system, because if we provide the vaccines at the school, the student will not need a parent present, but we will need a consent form. And that's the same way that we do it for flu and for other vaccines. Now, we have to talk to the school. I haven't talked to them with regard to this. We are meeting on Monday because the schools is the setting, so they have to have a say on what is going to happen. But the suggestion from the State Department of Health is to facilitate and not hinder the process in a school setting where the student belongs to that school, that we have a record of the student, that the parent doesn't need to be present.
Pregunta en español para Telemundo. Doctor Pino, con este nuevo guideline que ha dado los CDC, ¿se espera o qué esperan ustedes con respecto a los niveles de casos positivos y porcentajes de casos positivos? Y en dado caso de que la lógica indique que van a aumentar un poco, ¿qué medidas tienen con respecto a ese posible escenario?
So I don't expect the case to go too high. We may see a little bump. I really don't know. With regard to, all right, that's it. First in English, yeah? All right, we do both. So with regard to the number of cases, we may see a small increase, but the immunization levels are high. So even if we see cases, what we are trying to avoid with high immunization rates is transmission. So the fact that it will go from person to person. And that's where the vaccine comes into place. It doesn't mean that someone can get it here and there, but because a lot of people are vaccinated, it's very difficult to move it around. But also, our vaccination rates are higher than we are reporting. We are under-reporting. As I mentioned here before, we still don't have the data from the Department of Defense and the data from the Veterans Hospital that have vaccinated thousands of people. So we know that we are above 50%, probably around 56, 57%. With that, we are in a good place. En español, yo no pienso que el número de casos se va a elevar mucho con la relajación de las medidas. Pero como dije en inglés, la responsabilidad está en el individuo. El individuo ahora tiene que decidir si se quiere proteger y si quieren proteger a su familia. La comunidad con este nivel de inmunización está protegida para la mayor parte de la comunidad, más de la mitad. Los demás ahora tienen que decir, yo me quiero proteger o yo quiero proteger a mi familia. Yo no pienso que vamos a ver un número elevado de casos, pero si sucede, no pienso que sean tantos. Me preguntaste también qué podemos hacer si los casos se elevan. Habría que ver a qué nivel se elevan. Si es un blip en el número de casos, pues no tienen ninguna medida. Y yo espero y deseo y rezo de que no haya un número elevado de casos.
Right.
Mayor Demings, I have two questions coming to you. The first is from Gabrielle Rousson with the Orlando Sentinel, and she asks, Disney World recently increased its attendance capacity in the past few days. Did Disney brief you on what the news attendance capacity is now, and any more details on the situation?
I was aware that Disney was going to increase capacity, and I think that they still are endeavoring to follow the CDC guidelines, and what they're doing is very responsible.
Is coming from Ryan Lynch with the Orlando Business Journal, and he asks, what kind of concerns, if any, for businesses who may set up their own mask policies and face opposition?
Well, we are going to leave that up to businesses to do what they think they need to do in regards to their employees or dealing with the level of consumer confidence. What I can tell you is that not everyone in this community is ready to remove their facial coverings and go and patronize businesses where there are no facial coverings there. So I believe that in order for businesses to be successful, they're going to have to be sensitive to the will of their patrons in that regard. There will be some individuals who obviously are still going to be wearing facial coverings because they are not yet fully vaccinated, but yet they want to protect themselves, and they should have the opportunity to do that. And so if you're a business person, you have to make some business decisions that's in the best interest of the overall viability of your business. So I don't think that you're going to see soon, tomorrow, today or tomorrow, all businesses removing any type of directives or guidance to their patrons. Under the current executive order that the governor has put in place, he has allowed businesses that discretion. And so that is something that is consistent throughout the entire state of Florida. Okay, it appears that that is the final question of the day. Just want to let you know that we're going to move to a weekly pandemic update here within Orange County, and we will be doing that generally on Wednesdays at 4:30 p.m. So the next briefing will be next week on Wednesday at 4:30 p.m. Thank you all for joining us, and again, to these individuals who have been on the front line of the response, thank you for your efforts here within this community. Thank you, Dr. Pino, for the wonderful partnership. Thank you to the Florida Department of Emergency Management for the partnership with Orange County as well. Have a great weekend.